Now I want to look at a classification of drugs, right? So these are a set of drugs that when you give them in the body, they affect bone metabolism. So what is bone metabolism? Formation of bone or breaking down of bone. Do you understand? So what are the examples of drugs that could actually affect these various processes? So drugs that affect bone metabolism include those that will weaken the bone, and also some will strengthen the bone. Do you understand? So they are different. So let's have the overview. So bone metabolism is a balance between what? Formation of bone and also breakdown of bone. Do you understand? So drugs can disrupt the balance, leading to the breakdown being too much, so there is bone loss, or sometimes it will help in the formation, so you are having what? A good recovery of a bone that was weak before, So drugs that weaken the bone now. So these agents, they increase bone resorption or they reduce bone formation. They lead to what? You having weak bones. So drugs like the glucocorticoids, like the what? Prednisone, the dexamethasone, those are NSAIDs. They reduce osteoblast activity and they increase osteoclast survival. So there's risks of you developing weak bones when you are taking those drugs. It's like their side effects. Then we have heparin and warfarin. Okay. We have the aromatase inhibitors like the anastrozole, the letrozole. Okay. They reduce estrogen levels, so they make the bone weak. The thyroid hormone, proton pump inhibitors, they reduce calcium absorption. We have the selective serotonin reuptake inhibitors, anti-epileptic drugs like the phenytoin, valproate. Okay, this is Alendronate. They also have drugs that strengthen the bone now. So drugs that strengthen the bone, those ones that are basically used in treating all those conditions that will make your bones weak. So we have the bisphosphonates like the Alendronate, we have the Risedronate, we have the Zoledronic. They inhibit osteoclast-mediated bone resorption. So they're usually first line of treatment for anything osteoporosis. Then we have the denosumab, which is like a monoclonal antibody. So also have the Teriparatide Stimulate osteoblast activity. We have the selective estrogen receptor modulators like the Raloxifene, Calcitonin, then also the thiazide diuretics. So those ones really have an effect on the bone, and they basically help and promote bone formation.